Hello, my name is Jaslyn Woods, and today we will be performing a physical head-to-toe assessment. This is for Advanced Health Assessment, Fall 2025, Dr. Buford's class. This is my patient. We have already gained consent to perform the assessment today. Let me start by scanning the room. These are my materials I will be using. Alright, so we're going to go ahead and get started. So I'll start by inspecting the patient's skin. So the skin is clean, dry, and intact. He does not have any edema, any lesions present, or nevi. So, and the skin has good turgor. Turgor is intact. Alright, so it is skin is warm and dry to touch. And then we're going to move on and inspect his head and scalp. Inspect and palpate. Alright, there is no indentations, no lesions present, no tenderness, and his skin color is appropriate for ethnicity. So then we're going to move on and we'll begin to do assess the temporal arteries. So they are +2 and equal bilaterally. So then we're going to test for TMJ. Could you please open and close your jaw? All right, good deal. No crevices noted there. So then we'll move on and assess the lymph nodes. So we'll do the preauricular, postauricular, occipital, tonsillar, the submandibular, submental, the anterior clavicle, cervical, the posterior cervical, and the supraclavicular lymph nodes. So there was no tenderness noted during that assessment. So then we'll move along and we'll test the cranial nerves. So we'll start with cranial nerve number 5, trigeminal. So we'll test the sensory portion of it. So I am going to touch your face with the cotton ball. You just tell me where you feel the touch.
Right cheek, forehead, left cheek, chin.
All right, good. So cranial nerve number 5, trigeminal, is intact. And so then we're going to test cranial nerve number 7, which is the facial nerve. So I'm going to have you smile real big, raise your eyebrows, do a frown for me, puff out your cheeks, and then pucker your lips. Good. Cranial nerve number 7, facial, is intact. So then we'll move ahead and we will do the ear. So I'm going to start by inspecting the ear. The ears both are symmetrical to the patient's head on each side. Then we'll go ahead and inspect the pinna and the tragus. I will use my octoscope to perform this exam, and also look into the auditory canal. All right, so I pulled up and back. I'm looking on each side. All right, so the auditory canal is clear and the temporal membranes are pearly gray. So then we'll perform a set of 3 tests. And we will be testing cranial nerve number 8, the vestibular ocular nerve. So we will start by performing a whisper test. So I'm going to whisper 3 words in each ear. You just tell me repeat back what I'm saying.
4, 5, 6.
All right, good. So the next test is a Weber test. So you just tell me if the vibration is heard symmetrically.
Yes.
All right, you heard in both ears.
Mm-hmm.
All right. And so we're going to perform a Rhines test. And I'm going to test your hearing with your mastoid process on the mastoid bone. All right, which side was louder?
The left.
All right. So moving ahead, we are going to move on to the eyes. So I'm inspecting the eyes. I'm looking for symmetrical eyes. I'm looking for the conjunctiva, the eyebrows. So the sclera is clear. There is no discharge present. All right, so then we're going to go ahead and perform our visual acuity exam, and this is testing cranial nerve number 2, which is the optic nerve. So please cover your left eye. All right, and read that bottom line to me.
LTFPH.
All right, cover your right eye.
LTFPH.
All right, good. So cranial nerve number 2, optic is intact. So then we're going to move ahead and I will test cranial nerve 4, 5, and 6. All right, so I'm starting with the extraocular movements of your eye. So first I want to start by asking you to follow my pen. Alright, good deal. So cranial nerve number 4 is intact. That's the ocular motor. Alright, so then we're going to go ahead and test for retina. Yeah, just look straight ahead for me. All right, redness is present. So then we're going to go ahead and test your peripheral vision. So just look straight ahead one more time for me. All right, pupillary response. The pupils were both equal and reactive to light. Also, I want to test your peripheral vision. So you just tell me, cover your left eye for me. All right, how many fingers am I holding up?
1, 2, 3.
Okay, and then cover your right eye. How many fingers am I holding up?
1, 2, 3.
All right, good deal. And just, I want to test your peripheral vision one more time. I want to tell me when you see my hands.
Let's see.
Now.
Now.
All right, so we're going to move on to cranial nerve number 2, which is smell. Olfactory. So I want you to close your eyes for me. All right, so I'm going to cover one of your nostrils. First, I'm inspecting and I see that each nostril is midline intact. So I'm going to go ahead and palpate here and assess your cranial nerve number 1. So what do you smell?
Alcohol.
All right, and then I'm going to try the other side. Tell me, what do you smell?
Alcohol.
Okay, good deal. So cranial nerve number 1, olfactory, is intact. So then we're going to move right on and do the next exam. So the next exam, I need you to turn around for me. Alright, so, and I am just leaning forward just a little bit. I am inspecting the patient's chest for symmetry and symmetry, and the chest wall is equal upon expansion. There is no accessory muscle use. I am going to also now begin to palpate for fremitus. Alright, no fremitus noted there. So then I'm going to go ahead and get you to, can you please say 99 for me?
99.
Alright, good. So then we're going to go ahead and listen. Take a deep breath for me. Alright, one more time. Alright, good deal. So can you please turn back around for me? Alright, so also I need to inspect your carotid arteries. Alright, each carotid artery has been palpated. It is a +2. I'm going to also listen for any groups. Using the bell of my stethoscope. Take a deep breath. Hold it. Alright, you can let it go. And take another deep breath for me. Hold it. Alright. So there were no groups noted upon auscultation of the carotid arteries. So then we're moving on to the front of the anterior chest wall. So first we've inspected, and their chest wall is the symmetrical. Alright, so then I'm going to go ahead and auscultate the chest wall, the anterior chest wall. Alright, so lungs are clear upon auscultation. And so then we're going to move ahead and begin to examine the heart assessment. So I'm going to auscultate each heart sound, beginning with the aortic. So the aortic is located in the second intercostal space, which is on the left sternal border. All right, and then moving on to the palmate, which is located in the second intercostal space in the right sternal border. And then Eve's point, which is located in the third intercostal space in the left sternal border. And then the tricuspid, which is located in the fourth intercostal space in the left border. And then the mitral valve, which is located in the fifth intercostal space in the left sternal border. So this is also the point of maximal impulse. So I'm going to palpate. All right. And all S1, S2 sounds were normal. And then moving on, I'm going to listen to the apical pulse for 1 minute. All right, the apical pulse is 80. All right, and then moving further, I'm going to ask you to please lie down for me in a supine position. All right, and then raise your head at about a 30 degree angle, and then turn your head for me. All right, no JBD distension noted. All right, you can lie back. Just lie back flat for me, please, sir. All right, and then I'm going to go ahead and listen to your chest wall again. All right, beginning with the aortic, pulmonic, Erb's point, tricuspid, and the mitral valve. All right, good. And then we're going to move on to the abdomen. So just looking at the abdomen here for inspection, I see that the abdomen is flat. The patient does not have any distension. All right, so then I'm going to go ahead and auscultate each quadrant, beginning with the right lower quadrant. All right, valve sounds are present. So then I'm going to go ahead and palpate. Let me know if you notice any tenderness. All right, so no tenderness present at all. And then we're going to palpate for the spleen, for the liver first, and the spleen. All right. So next we're going to percuss the abdomen.